Today we're continuing our BCBA task list study guide series with discontinuous measurement, focusing on interval recording and time sampling. This is a high-frequency topic on both the BCBA and RBT exams, not because the definitions are hard, but because the exam tests your ability to select the correct measurement system under constraints. In this video, we'll break down what discontinuous measurement is, its limitations, the different types, and, most importantly, how to choose the right system on the exam. Discontinuous measurement is heavily tested because real-world ABA settings rarely allow perfect observation conditions. On the exam, you'll often see limited observation time, multiple students or clients, high-frequency or continuous behaviors. The exam is testing whether you understand the accuracy trade-offs involved in discontinuous measurement and whether you can match the method to the behavior, the goal, and the constraints. This matters not just for passing the exam, but for making ethical and effective database decisions in practice. In ABA, measurement systems fall into two broad categories: continuous and discontinuous. Continuous measurement records every instance of behavior. Discontinuous measurement records samples of behavior rather than every occurrence. Both rely on direct observation, but they differ in how data are collected and interpreted. The key trade-off here is accuracy versus feasibility, and the exam expects you to recognize when continuous measurement is not realistic. Discontinuous measurement divides the observation period into equal intervals. Behavior is recorded according to specific rules for each interval, rather than continuously. It does not require constant observation, which makes it practical in many ABA settings. You may also see this referred to as interval recording or time sampling. It's commonly used when observation time is limited, resources are constrained, or behaviors occur at a high rate. A critical point: discontinuous measurement provides estimates, not exact values. It does not give you true frequency or duration. All discontinuous methods introduce systematic bias. Whole interval underestimates behavior, partial interval overestimates behavior, momentary time sampling varies. A common exam trap is treating discontinuous data as if it reflects exact behavior levels. Always interpret discontinuous data with caution and always identify the bias first. Types of discontinuous measurement: there are four main types you need to know for the exam: whole interval recording, partial interval recording, momentary time sampling, or MTS, planned activity check, or PLACHECK. Each differs in what is recorded, how bias occurs, and what behaviors they're best suited for. PLACHECK, in particular, is a group-based variation of MTS, commonly used in classroom settings. With whole interval recording, behavior must occur for the entire interval to be scored. If the behavior stops at any point, the interval is not recorded. This method underestimates behavior, especially when behavior starts and stops. Whole interval recording is best for continuous behaviors you want to increase, such as sustained engagement. On the exam, remember, whole interval equals underestimation. Whole interval recording is most appropriate for continuous behaviors. Duration targets goals focused on increasing behavior because it provides a conservative estimate. It's useful when you don't want to overestimate progress. On exam questions involving sustained engagement or duration goals, whole interval is often the correct choice. With partial interval recording, behavior is recorded if it occurs at any point during the interval, regardless of duration. Even a brief occurrence counts as a full interval. This method overestimates behavior, making it sensitive to brief responses. Partial interval recording is commonly used for high-rate or brief behaviors, especially those targeted for reduction. Partial interval recording is ideal for brief, high-frequency behaviors you want to decrease. Situations where missing occurrences would be problematic. However, it should not be used for continuous behaviors or increase goals. A common exam trap is using partial interval to measure behaviors intended to increase. Avoid that. Momentary time sampling records whether the behavior is occurring at the exact moment the interval ends. The observer only checks at that moment. MTS is the most efficient method, requiring minimal observer effort. Its bias can go either direction, depending on how behavior timing aligns with the sampling moment. MTS is best when you're monitoring multiple behaviors, observation time is limited, you're in a classroom or group setting. The exam often focuses on feasibility and efficiency, when MTS is the correct answer. Always remember that MTS trades precision for practicality. PLACHECK is a variation of MTS used specifically for group behavior. Instead of recording individual behavior, the observer counts how many individuals are engaged at the interval end. It's commonly used in classrooms to estimate participation or engagement. A common trap is confusing PLACHECK with individual MTS. PLACHECK measures group participation, not individual responses. This slide summarizes the key differences. What each method records direction of bias best use cases exam. Focus the exam frequently test your ability to discriminate between these systems, not just define them. Remember, discontinuous measurement is a practical alternative, not a replacement for continuous measurement. This is a core exam concept. Partial interval overestimation, whole interval underestimation, MTS variable before interpreting any data. Always identify which bias applies. Many exam questions hinge on this single step. Choosing the right system depends on 4 things. Behavior type, goal alignment, setting constraints, observation time, for example. Increase continuous behavior, whole interval, decrease brief behavior, partial interval group, engagement, MTS, or PLACHECK. Always consider all criteria together. A simple decision rule. Is continuous measurement feasible? Is the behavior brief or high rate? Is observation time limited? What is the intervention goal? The exam rewards systematic reasoning, not guessing. In this classroom scenario, continuous measurement isn't feasible. The behavior, hand raising, is brief and frequent. Partial interval recording is the best choice for tracking this type of behavior under time constraints. This is exactly how exam scenarios are structured. Here, the behavior is brief, high-rate screaming intended for reduction. Partial interval recording is appropriate, and it will overestimate behavior. Always pair method selection with bias prediction. The biggest mistakes include treating estimates as exact frequency, using the wrong system for the goal, ignoring bias entirely. The BCBA exam frequently tests your ability to avoid these traps. Inaccurate measurement isn't just a technical issue, it's an ethical one. Poor data leads to poor decisions, ineffective interventions, and service justification problems. Selecting the correct measurement system supports ethical, evidence-based practice. Continuous measurement offers precision but requires constant observation. Discontinuous measurement offers practicality when constraints exist. The exam focuses on selection logic, bias recognition, and real-world feasibility. Discontinuous measurement is sampling, not exact measurement. Every method introduces bias. Effective selection requires understanding definitions, limitations, and goals. This skill is essential for both the exam and clinical practice. Identify behavior type, intervention, goal, measurement, bias. Watch for keywords like overestimate, underestimate, and variable. The exam is testing whether you can connect all of these under pressure. To build confidence with measurement decisions, practice BCBA-style questions that mirror the exam. Visit www.bcbmockexam.com to strengthen your decision-making and time management skills. Remember, discontinuous measurement is sampling. Never assume it reflects exact frequency.